Good afternoon. Steve Seepersod coming to you from the campus of Binghamton University. And if you're curious at all about what location we're broadcasting from on campus, we're here in the engineering building in the Noel McDonald Commons, probably a familiar location to some of you watching. Welcome to Serving Rural and Underserved Populations. This program is part of Launch Day here at Binghamton University. It feels a little funny, a little bit exciting, a lot exciting to hear Campaign Launch Day said out loud. A big day for us here at the university. So thankful that you have given up part of your Saturday to be with us. And so we have a great program for you over the next 45 to 50 minutes. In this interactive, and the key word being interactive salon experience, we're going to hear from two amazing faculty members here at Binghamton. They're going to tell us about the work that they do. And as they do that, I encourage you to send us your questions. Start now if you want. So your questions are the juice that will keep this program going from now until about 3:50. So type your questions into the chat window. These salons are meant to be places for conversation. So don't be shy. Send them in. Today we're going to be talking about trust, and it's an abbreviation for the Rural and Underserved Services track. And pardon me while I read, it's a collaboration between many partners: Binghamton University's Decker College of Nursing and Health Sciences, our School of Pharmacy and Pharmaceutical Sciences, our Department of Social Work, SUNY Upstate Medical University, and the local greater Binghamton community. The main goal of Trust is developing a group of healthcare professionals that are dedicated to serving rural and underserved populations through a network of interprofessionals. And like many programs, many problems today are very, very complicated, requiring collaboration across many areas. Trust is basically the latest example of this, and making some good news in a short amount of time since it was formed. And so we are very happy to introduce our featured speakers for today. Sitting to my left, Bennett Doughty, Clinical Assistant Professor of Pharmacy Practice in the School of Pharmacy and Pharmaceutical Sciences, and Sarah Young, Assistant Professor of Social Work in the College of Community and Public Affairs. And so thank you both so much for joining us, and it's so great to be able to talk about trust and the work that you do as part of our Campaign Launch Day. So it's great to be able to say Campaign Launch Day. So to get us started, let's have each of you talk a little bit about yourselves and what you do, and then we'll dive into talking about trust and the overall objectives of the program.
Sure. Thank you for having us, Steve. I'm really honored to be here and have this conversation with the both of you. So I'm Sarah Young. I am a practicing social worker, and actually I think part of why I love trust and I'm excited to talk about it is, for me, I grew up in this area, and even though I've practiced in London and Jamaica and Mississippi and Michigan, coming back home to Binghamton has been really special. And so for me, I know what it means to grow up in a rural community. My high school, I was looking last night to try to be accurate, I think we had 35 students in my graduating high school class, so very rural. For us, the biggest city was a city that had 10,000 people, for perspective. And so I remember as a young person, I didn't know exactly what it meant to grow up in a rural environment, but I knew that some of my classmates didn't have access to the dentist because the dentist didn't take Medicaid insurance, for example, or some of our classmates didn't have access to a mental health therapist, or the doctor was too far away and folks didn't have gas money to get there. So these are all things I think that formed honestly my passion for why I'm in social work and care about underserved and rural populations. But it's part of my fire for trust as well, and we're excited to share more about the program with you and in conversation.
And I like a lot of what Sarah has said too. I'm also from a rural area, grew up in central Maine, so not around here, but similar. We had, I think, a graduating class of around 60, so you beat me there. I'm from the School of Pharmacy. I'm a practicing psychiatric pharmacist, and I say psychiatric because I really think that's what drew me to a program and to help build a program like this, because it's really about the people. And I think there's a lot of, in going through a program similar to Trust at my alma mater, you learn about a lot of gaps in our healthcare system. We learned that 20% of health outcomes are reliant on clinical care. So what's the other 80%? And when I learned that in my education, it kind of just sparked something. And I think that missing piece, and we're really trying to nail down in the program like this as well, is to try to make sure that we are including the patient in that team, looking back at everything that's going on, not just the medications we're using or just the therapies we're kind of using with one-on-one with the patients. So trying to keep that conversation going, and I'm a bit honored to have all the support in getting this initiative off the ground from our colleagues in social work, nursing, and medicine.
It sounds like you can really relate quite a lot to the people that you're looking to work with, having come from those small environments, talking about the biggest city has 10,000 people, or your high school has 200 people maybe total across all the classes, which is small by many standards. So talk about trust and how it came about, and from a high level, what the overall objectives of the program are. Then we can go on down and kind of go on the tactical level and look at measures of success and things like that.
Absolutely. Yeah.
So I can start and then I'll pass it over to you. But I think trust began first. I had the opportunity to be in a program similar at my alma mater, and that was one of the I think most enjoyable and motivating things that I did during my 6 years of education, and I want to be able to give that opportunity to other students. So me and my probably first year of employment here, all motivated, I kind of went over to Sarah, and our first interaction, I said, hey, so my name is Bennett, and I have this idea for potentially starting a track called Trust, or I think at that point it was just Rust, so I'm glad we put the T on there. And it kind of grew from there. We had known that the focus, and this really ties into our objectives, is that we wanted it to be interprofessional. I mean, there are so many parts of healthcare that are so siloed, and I think we are moving more towards a collaborative environment, but we still have a ways to go. So we wanted to make sure we had as many disciplines involved as we could, and we hope to grow from here as well. And we wanted to really focus on the patient, again, like I mentioned before, and allowing not only our passions to grow, but motivating our students. And the program as a whole is comprised of multiple different facets, and I'll turn it over if you want to talk a little bit more about those.
Yeah, I'm happy to. And the only thing I'll say about that, I remember that first conversation when Bennett came to my office. And I don't know what you were expecting, but it seems like you didn't know necessarily if there would be buy-in from other disciplines. And I think you really spoke to a need, at least in our Department of Social Work, but certainly with our colleagues in nursing, and later with our colleagues in upstate medicine. I think we're always looking to give our students that bridge between the classroom and the applied information and the actual communities they serve. So you seemed a little surprised when I was like, let's do this, let's figure this out. And I'm so glad that we had that conversation. And so to just speak about what trust is, I'll speak about the workshops and then pass it to you for the service activities. So trust, our goal ultimately is to really train the future of healthcare. So we believe that the future of healthcare is team-based. We know that by coming together across disciplines, I think healthcare providers can have those engaged conversations. I've noticed that from our students' perspective, it solidifies why they've chosen the profession they have, but they also, I think, learn from colleagues who are able to provide a different lens on a particular problem. So it's just really, we think it's what's best for healthcare. But in terms of what we do, we have 4 times a year, we have what we call retreats, but essentially workshops. We get together 3 to 4 hours every time, and we do a deep dive on a particular population. So for example, we've had an entire workshop on serving the needs of veterans or serving people with intellectual and developmental disabilities, folks in terms of just a broad view on rural healthcare, folks in terms who are using substances, so substance use and misuse. So we do a deep dive, a workshop solely focused on those populations. And so at those workshops, the faculty who are experts in particular populations, we give an overview. We move into a panel discussion, which I think far and away is so impactful. Our students tell us this. And those panels are an opportunity where patients who are members of the communities we're talking about, service providers who have expertise and are currently in the field, they are able to answer questions and respond directly to our students. We always have a case study where, again, that interprofessional part, we have a simulated case based on our own professional experiences as healthcare providers. And students work together to provide their own lens, whether it's medicine, nursing, pharmacy, or social work. And there's some debates that happen about the best way to serve that patient, and it's nice to see that conversation happening. And we certainly close things out and have opportunities for networking. So 4 times a year we do those workshops. And it is a 2-year program. We should mention it's an add-on. So we are attracting motivated students in our professions, and it's additional, right? So these are folks who are giving up of their weekends in addition to the faculty for those workshops.
And one thing I'll add on to is, like Sarah was saying, these are motivated students who really have developed a lot of this program, helped us develop this program as they went forward. The number of students we have have the 2-year program. We have one cohort, so a cohort of 40 students. So right now with 4 disciplines, we have 8 to 10 students from each discipline. So at any point, we'll have 40 and 40. So the goal is 80. We had just actually graduated our first cohort of around 20, so it was kind of limited because we are still a new program, but it's really exciting because, I mean, just looking even to next year, I've already had a lot of students come up and ask about it. So, but the second big part, we have the learning workshops, and then these service activities are really what allows our students the ability and experience to go out and learn with the community and give back to the community. So in these service activities, they range from a variety of different topics. So we have one on affording medication, so how to maneuver through some of those extremely high copays, what are resources we have. We do safe medication disposal. We have activities focused solely on what certain populations are interested in, like the intellectual and developmentally disabled, LGBTQ+, and a few others. We have a few in development next year for dental hygiene, so focusing on how to talk with those people who might not have resources that will go to the dentist, like Sarah was mentioning before. And these are all led by second-year students. And that's really cool to see, especially now that we have those 2 years in. These students are developing these activities themselves, and then really pushing the development and implementation under faculty guidance, but the amount of motivation they have has really pushed things very, very far. Our substance use disorder activity trained about 360 participants this past year, and I know we're still in the academic year, so they have really pushed themselves and get the opportunity to teach their colleagues, because all these activities are smaller than our 80 people that were, maybe like 3 or 5 people, but interprofessional. They go out to these community centers, senior centers, whatever it might be, do their activity, whether it's usually health education based, and they will mix up the groups time to time, have feedback, build upon it, and it really allows them to shine, I think.
You mentioned the size of the program being what it is, and you already have students asking about wanting to get in the future. Are you looking to grow the program, or do you feel it's right-sized where it is to be able to give the amount of attention that you would like to?
So, and that's a really good question. What I will say is our intention is to grow. Not in the, maybe nothing is for certain, but I think what we really are focusing on for growth is more disciplines involved. We want to be very specific and with our development, because we actually just, we did a pilot year, and we have just finished the 2-year full rotation. So we are now done development, which is a great feeling. And now that we have done that with our 4 core disciplines, because we didn't want to, overextend and bring in all these disciplines at once and try to balance the development with making sure we're reaching all these goals for every student involved. We do plan to reach out. I already have reached out to public health. We have a lot of other resources up at Upstate too. They have a nursing program, public health, et cetera. We have our PT program here. So we do hope to grow, especially in disciplines. In terms of student numbers from each cohort, that's always going to be up for discussion too, but the important thing is being so interprofessional. We never want it to be heavy with one discipline or whatever it might be. So we really try to make it that interprofessional experience the best it can be, and making sure that these students are getting what they want, and not sacrificing that for just pure numbers.
That's right. Yeah, I would agree with Bennett. And the only thing I'll add is it's an exciting time to be at Binghamton, because we see the health sciences campus growing, and we see the potential, as you mentioned, physical therapy, speech and language pathology. I think we can find other disciplines as collaborators, and I think that only strengthens our model, because we have a diversity of disciplines and a diversity of students in our program. So we are looking to grow. Now that we've got the handle on this program, we're excited to sort of see how far it can go.
Maybe the other thing too is not only in disciplines, but we focus on obviously the community member as such an important part of our team and our program, that we also expect to grow in just the amount of people we hope to be able to interact with, and amount of community centers and different other, say, community just activists, et cetera. So we hope to expand our ability to reach more subsets of people. In the Syracuse area, we're expanding and going to other locations to deliver these services. So that is, I expect a lot of growth in that, especially the next year, now that we are, maybe I shouldn't say it too loud, but hopefully out of the many restrictions of the pandemic. So
it sounds like those are the 2 numbers to really keep the most in mind, is having that balance between the different disciplines. You're not oversized in one area, under in another, and then also ultimately it's the service delivery, and so being able to reach people and how many patients you're able to help is the true measure. So that's right. Very, very good stuff. So tell me about the reactions that you had received in advancing this concept and getting this out there and trying to get backing and resources. I'd imagine you probably got a fair amount of, thank goodness, this is just the right time. In fact, we've needed this for a very long time.
I think that's right. I'll speak from the community partner perspective, and Bennett, you might have some more to add too. I think when we approach community partners, we do so knowing that our healthcare system in many ways is overburdened, and so we do it with a level of humility. We talk about trust, we talk about the benefits, and then we really hope it's a win-win for our partners and certainly for our students. I would say we've been met with open arms for so many partners who are excited to both connect with Binghamton, to connect with our students, and to really engage our students in a meaningful way, in a way that helps the community. So I would say there's been a really positive reception. We're expanding our list of community partners. That has on occasion meant increasing donors and folks that are interested in our project. And so, you know, again, we are met with folks who say, we want to know more about trust. We want to engage our students in this activity. So we're just always excited. And our faculty are champions of this program too. So I think we see an opportunity to integrate trust into some of the work we do, whether it's our research or our teaching.
And I'll echo what you said there. I mean, I've been very, happy and very optimistic about, even you mentioned the community members, but also the faculty and the students. I mean, coming to Sarah that first time, I don't think I realized how big of a program this could turn into. And I think all the support that with our colleagues in nursing, medicine, I mean, everyone is giving up also their own time as faculty members to come and do this program, because I think we know how important it is. And I mean, I get energy from our students all the time, just seeing them grow. So that has been a really, really cool part of just being at Binghamton in general. I mean, everyone's been so supportive and saying, yes, I want to help in this and I'm interested in it, which is also kind of cool because it allows us faculty to do research, but also, you know, do work in areas that we are already really interested in and have already focused on. As far as other support, we've been very fortunate too to partner with local community partners who have been able to give us small stipends here and there to help the program get off the ground, and have been very fortunate to have other support come in that we are working to kind of distribute to our students, because our students, you know, you can imagine probably are coming from underserved areas as well, and I know that potentially we're missing a section of students who might need to work and can't give up, you know, like a Sunday or whatever it might be. So we've been lucky to have support there and directly to our students.
Mm-hmm. So tell me about the students that are attracted to a program like this. Is it mostly people that come from backgrounds like yours, very small, and so this is easier to see helping people who are like me, or do you get a mix of rural, suburban, city types that are just kind of looking for a different experience?
You know, I think that in our current cohorts, we have gotten, I'm thinking back to all the applications we got, and a lot of them have mentioned a lot of past community service, and maybe not coming directly from those communities of underserved, but having a pretty robust experience with working with them. So yes, we have a lot of people who did actually come from underserved or you know, out of the country, et cetera, but we've been fortunate that we are attracting students who have a passion for working with other individuals who might not be as well served as we are, and really putting extra time and effort into reaching out and giving help to them.
I agree. Yeah, I will say, I'll speak from the social work perspective. We often attract students for whom they have had a background that has been underserved themselves. And so, you know, we have students of color, we have students who have experienced rural environments that have had a lack of health care. We have students who open up and talk about maybe their parents have had a mental health struggle, or they have a family member who's a veteran. And so as we're screening for our future trust scholars, we do ask them, what motivates you to join our program? Because we want to be very intentional that students are committed to this particular service element, which, you know, again, I think it probably is fair to say that across our disciplines, we are helping professionals and healthcare providers. So there's an element of passion when it comes to serving folks, but our trust students, I think, take that to the next level. They're ready, willing, and able to serve, whether it's their own experience that drives them to make healthcare more equitable, or a lived experience of a family member, a friend, or just a passion to learn more. I mean, I think our students come to retreats curious, so they may have an expertise in one of our learning retreats or our workshops, but I think they're really open. They ask good questions. They keep us on our toes, Steve. I mean, they really, we cannot get anything past them, not that we're trying to, but they'll say, tell us more, or, you know, what is the latest research on this population? They really are so engaged when we come together as a community, which is rewarding for me. I mean, it's part of what keeps me so committed to this program.
And we've never had any student who, I guess the way to describe it is just checking a box. Like, we've been very fortunate that every student that we are interacting with is extremely motivated and extremely interested in the program that it makes our jobs fun, and really it's nice to see them grow, but everyone in the program has been extremely passionate and motivated to help the program grow, but also connect to the community members out there.
It sounds like the students you have are very much on brand for Binghamton University, where they work hard, they get a ton of questions, they're really eager to go at it and to try to do a little bit extra, and it's great to have that energy to tap into. And talk about the importance of the experiential learning part. And it's something that's a huge priority here at Binghamton, and we hear about all the time. And what sets this program apart? It sounds like it gives a little bit of a different experience than maybe you have with other things at Binghamton or elsewhere too. Mm.
Yeah, that's right. I'll maybe share just a little bit about that. So I think it's fair to say that all of the disciplines we invite have an experiential learning part of their curriculum that already exists. So whether it's an internship or a practicum, however they place that, our students are getting that hands-on learning when they come to Binghamton University for that degree. But I think Trust really helps to enhance it. I mean, we have students that are practicing skills. For example, we've taught them a clinical skill around suicide assessment and how to talk to somebody about something as emotionally challenging as, are you having thoughts of suicide? And some of our students are very comfortable with those conversations, and some need a little bit of coaching, right? So that experiential learning, we hope, because we know that our colleagues are going to go out and serve folks who are in crisis, folks who have a certain amount of needs. We want them to practice those skills so that when they're in a true patient interaction, they feel much more comfortable. And so I think that interaction, that experiential learning piece of this, we just believe in it. We've seen it impact our students. We've seen them come away from retreats more confident, more sure. And I think, again, they might not come away as complete experts, because I think when you're in the field, you get that. You really get road tested as healthcare professionals. But what we hope they also come away with is the ability to know who to ask for questions. If they're in a situation where they're in over their heads and they know, okay, I can go to a nursing colleague and ask them, or I can go to this website because I've learned about it in our retreat, and sort of learn a little bit more about what to do in this situation. So I think, to answer your question, Steve, we just so believe in experiential learning, and our students are reporting that that's what they love about Trust, is they feel like they're doing the work. And I think it's in a safe and kind of a low stakes environment, right? So again, they are able to make mistakes and get that coaching and support, not just from faculty, but from each other. I think they're able to kind of help each other learn in a way that's really powerful.
I think there's a lot of everything that you had said, I completely echo, and it's nice to see all that come to fruition in the development of the program. But we do try to get as much community engaged learning as we can. And the one piece I'll add is that, yes, we have students who are coming from all types of disciplines with a variety of different clinical background, maybe in different levels. And what we like to talk about is that you don't need to be at a certain clinical level to be in this program. It's more of, yes, we do talk about the medicine, we talk about the therapies, but the important thing is learning how to talk with patients and talk with each other about them. So we are, right now recruiting the undergrad nursing students to come in, and one of the questions was, what if they're not at the full caliber of the doctoral students in nursing? And I mean, that's not a concern at all. It's more of, yes, we can learn from other people, and there might be deficits in some clinical knowledge, but you are learning actively from just talking with a patient or hearing people, talk on the panels. I mean, we've been so fortunate to get, I love them. I mean, I feel selfish saying, I look forward to that every single time.
Me too.
And I think that is even kind of community engaged active learning, because they're not delivering services, but they're hearing from firsthand, people who are in the community or working with them, how they can help in their careers and in the future too. Mm-hmm. So I think that we've done our best to make sure we are continuing to incorporate more and more active and engaged learning experiences.
Well, it sounds very inclusive in the sense that wherever somebody's coming in from, it's going to take them where they are, is just level them up. It's going to make them better in whatever they do. And they're not expected to be the expert on the island. You can be out there practicing 30 years and still not be that. And that collaboration is a great skill to develop throughout their careers.
Mm-hmm. Yeah, I love that, Steve. And leveling up, I think we need to borrow that phrase, because we hope that we level up our student skill set. Mm-hmm. We see that. And it does occur to me, we have bachelor's level, master's level, and folks that are earning a PhD or a clinical PhD. So I think that's a really unique opportunity at Binghamton is we truly see our students as colleagues, as collaborators, and at all education levels, I think they're learning from each other. So we hope that somebody who's in a bachelor's degree program might interact with somebody who's in a master's and see a path for them to continue their education. So I think that might be happening as well.
I think another part too of the engaged aspect of the education is, we do 8 workshops on 8 different populations, but I think we give our students the tools to explore much more than just 8. I think that in talking to these 8 populations, they kind of learn some of the barriers, how to ask and work with people who they might be unfamiliar with. So I think that's another part that we hope our students, and have had feedback from them, but we hope that they get out of the program.
So just thinking about some of the groups that you serve, say veterans in particular, who can be just hard to reach for whatever variety of reasons, how eye-opening is it for the students to be able to work with populations like this and be able to feel that they're making a difference? And veterans, for example, just because they don't always come forward for help, or can be just tough to access, can be just a hard group to tap into, and maybe it's tough for the students to get opportunities to really learn. And so I imagine there's tremendous value in that.
Yeah, I think you're right.
I think that you said it pretty perfectly too, because it does, students don't always get the opportunity to work with some of these populations, and that level of discomfort sometimes is a positive thing. I mean, I'll kind of shift and talk a little bit about patients with substance use disorder. So stigmatized, these patients unfortunately are not getting services that they need, not only because maybe they're not available, but just because of their stigma that's inside them, that they can't go because they don't want to be seen that way, or whatever it might be. So in our students who work with that service activity, just seeing how far they've come from when they first started and with the material to where they are now as second years has really been eye-opening and really cool to see their growth, because now they go in and they can diffuse very uncomfortable situations and talk about this material that's hard to talk with just community members too, and trying to challenge that stigma, but not overly challenged at the same time. So kind of creating a level of comfort around a topic that is not easy to talk about, and hearing feedback from them, they want to do more and more and more activities. I think that's something to be said, saying that they get so much value and out of just seeing that work, even in small groups, that they want to create more. I think the students I'm thinking of were messaging me over winter break, and I was like, I really appreciate the motivation, but you guys can take a break too. And like, no, well, I get it. So it's been really cool to see that growth in those populations, and they want to have more opportunities to work with them.
Yeah, the only thing I'll add, and maybe it's a bit off topic, but it's really sort of something I want to make sure we get across, is that I think it's important that we break down stereotypes. So the healthcare system in many ways is working, but in many ways is broken, and has been broken for lots of populations for a long time. And I think one thing we offer is the ability to challenge those preconceived notions about populations. So for example, when we say serving a veteran, many of our students are holding on to an image of who that person is and what they might need. And quite frankly, I think some of that information is wrong. I think it's coming from media, and it might not always be accurate. So I think to hear directly from somebody who has that lived experience, and I think even more powerful for somebody to say, when I was served in this clinic, here's what didn't work for me, or here's a way that a healthcare provider had gotten it wrong, or had misjudged me, or had left me out of the conversation. I think that really impacts our students. And to a certain extent, I think we challenge stereotypes about each other. I mean, how often do we hear people who think that pharmacists are pill counters, or that social workers are meant to get transportation for clients or patients? I think we're able to sort of say, here's the totality of my profession, and here's where my profession can be enhanced by connecting with somebody who's a physician or a nurse or a pharmacist or a social worker. So I think that's one thing that we're learning, is that trust really is about breaking down those stereotypes, because we don't want students holding on to those things if it's going to affect their patient care in the future.
It's interesting to think about the image of the veteran, for example, and how that's changed. And for me in particular, being someone who was a child in the 1970s, and the image was the Vietnam veteran, and when they came back, and the many issues that they had with PTSD and substance use and things like that. And then fast forward to now, it's veterans from the various Gulf War conflicts with many of the same issues, some issues that are very, very different. So tremendous amount of learning opportunities, I'm sure, for the students in working with that population just by itself. And so I'm curious to hear about other groups that you work with, because I think rural and underserved, so that means, it kind of implies that some of these are outside of the farm country and kind of coming more into suburbia, into the city.
Yeah, I mean, we are definitely growing our community partners that are out there. One that comes to mind in another population, the intellectual and developmentally disabled population. We have Compassionate Care of Central New York right here, and working with their staff there and our students, I can't take credit for any of it, but our students are really making those connections, and I have heard multiple times from their staff that their programs that they brought in were so impactful. They can't wait for them to come back, and it's nice to hear that we do go out in rural, more underserved areas and try to give some aspect of care or learning from some take-home points for our attendees, but going to other areas where it might not be rural per se. We hope to continue to expand those as we go forward.
Yeah, I completely agree. I would say, one thing just to tack on to that in terms of intellectual and developmentally delayed populations, people living with disabilities. So often it's a population that's relegated to being cared for. But one of the magic things that happened in our panel, and all credit to one of our colleagues, we work with amazing faculty. I just want to make sure we say that, is that we've had folks with lived experience who themselves are intellectually and developmentally disabled people on a panel, hearing directly from them. And so often, I think populations can be hidden away, or there's an assumption that there aren't strengths there and people can't speak for themselves, but very much, populations can and need to. And so I think that's one of the benefits of our panel, and across populations, whether it's LGBTQ populations, people with substance use disorder, reproductive justice and reproductive health issues, all kinds of retreats that we do or workshops that we do. Students so often say they like their faculty, they love their faculty. Faculty have so much experience at Binghamton here, but students also like to hear directly from patients. And so we don't take offense to that. We also get inspired as well when patients can say, this is what would have been really helpful from a healthcare provider, or this just didn't work. I didn't feel like I was being involved in my own healthcare, and we know how important it is that people are. So
the richness of all those perspectives, being get the faculty on one side, get the patients on the other,
That's right.
and bring those all together. And so as we do this program today, we're a couple of weeks after the 2-year anniversary of the pandemic, and so it seems appropriate to ask how COVID-19 impacted trust in ways that are maybe negative, positive, and maybe somewhere in the middle.
Yeah, so I'm trying to think, we had just started, I think, our first cohort. We had done 2 retreats or workshops in person. And then I think I remember sitting in a meeting with all of our faculty and saying, all right, we are not going to be able to hold the next one, so what are we going to do? And I think that Sarah mentions our amazing other faculty colleagues too. I think we got together and quickly adapted, and we were able to take the majority of our content online, and we were able to actually reach out to more community partners for panel members too. So that was kind of a positive in a way that came out, that we were able to then kind of expand our reach on Zoom, of course, with our students, faculty, and community partners. So we were able to get more people involved in those sessions. I mean, yes, you lose out on the face-to-face contact, direct collaboration, and I'm very happy we're back to that. But I think our students were also very flexible in that too. So we did actually take some of our community service activities online too. We did some virtual telehealth to nursing homes with some of the local organizations here. Did a virtual Narcan training. So we were able to take the majority of everything online, but and learned from it too. I mean, we do still have some panel members which we are able to get because they're in faraway distances or wherever they're Zooming from, right into our in-person retreats because of what we've learned from past 2 years.
I think that's right. Yeah, we were undeterred. I mean, it certainly had us thinking in creative ways. But I think, one of the things we've gained from the pandemic is the access to healthcare and how it can be impacted. I think telehealth came to the forefront of how can we use this time, this strange time that we're in, and still connect, still deliver healthcare services. And our partners were undeterred. They joined us. Our students were there. I think we made it an opportunity that worked. I know one of the groups I was supporting in terms of the service delivery did a workshop on social media and how it impacts mental health of young folks. And so we were able to ironically deliver that through online services and have that conversation. So, I think that we were undeterred, but you're right, it did open up the ability to bring in community partners from far away who may not have been able to be with us in person.
And we did, I remember, change one of our deliveries of the workshops, I think, to be focused on underserved populations in general in COVID and what barriers they might be facing that otherwise we might not. So we were able to talk as a whole collective of just what this might pose for barriers, how we can help wherever we're at. I mean, we have students who are actively in the field practicing, so talking about these barriers and where we could potentially step up, I hope to open some eyes at that point too.
It's amazing how the pandemic forced people to be creative. Not that it's a bad thing, it's a good thing, and it ramped up a lot of processes or initiatives that were in the works for a while, and it's sort of like that thing you always talked about and maybe someday we'll do it. Now we have to because the in-person avenue has completely disappeared.
That's right. That's right.
So initiatives like Trust, whether it's an existing idea or a new idea, can't really come together and do anything without having a financial backing. So talk about where the resources come from to fuel Trust.
I mean, so the biggest resources I would say comes from our faculty time, which I've been very appreciative of and very happy to be a part of that team. Other financial resources, we've been very lucky to partner with an organization locally, Care Compass, who has supported us with some of the initial funding we needed to support everything from supplies for workshops, supplies for service activities, talking about transportation costs for some of our students too, who might not otherwise be able to go to an area or go up to, we split our workshops between Binghamton and upstate, so Syracuse area, so that distance has posed some difficulties for some of them. And we've also, like I mentioned, been very fortunate to have support for direct student scholarships coming actually this coming year from a donor, and that will, I hope, allow more students to be a part of a program that is an add-on, right? And we want to make sure that everything we're doing is directly for our students and encourage them to learn about how they can be stronger professionals and push them into avenues they would be very passionate about post-graduation too. So we've been very lucky to have a lot of that support already.
Yeah, I think that's right. We have a networking dinner, which we're learning about how to make food budget a part of our work. And we've been fortunate to have the support of our departments and our deans. But we are hoping that we can provide scholarships for all of our students, because increasingly, I think the students that are drawn to Trust are the same students who are having to self-finance their education. So they're working multiple jobs or they're caretaking for family members. And so the ability to provide scholarships is definitely on our radar. That's our ultimate goal, is to provide an incentive so that we can offset some of that labor and some of that time that our students are joining, because we don't want, having to sacrifice time for work into financial education. We don't want that to be a barrier to Trust. In fact, those students are often the very students we want in Trust, who are committed, who have known themselves barriers in their own lives. So that's definitely a goal for us.
We certainly don't want to have another barrier of, I have to make the decision between, do I continue a job and make money, or do this program that I really want to do, add to my education.
That's right.
So the ability to say, let's take this off of your plate and give you financial assistance, I think is wonderful.
We have, I think, unfortunately, in some of our, at least our first cohort has some people step back because of that. So we're trying to be creative with the funding we have right now. But as Sarah mentions, it's we're being creative and very diplomatic with everything and trying to spread as much as we can, so we can hopefully ease some of those difficulties for our students to hopefully decrease the losses as they go forward.
Mm-hmm.
So what other points of pride can you share from the time that Trust has been in existence, as far as outcomes that you really want people to know about that you haven't talked about so far in the last half hour or so, basically?
Yeah, I'll share one moment for me. And again, speaking of the pandemic and the opportunities, as we mentioned, there were points when our entire workshops were online and over Zoom. And, again, the way that we as instructors in a classroom might visit different student groups as they're talking and offer support, we would pop into a Zoom room. And there's one moment for me where I popped into a Zoom room where students were discussing an interprofessional case. And it almost makes me tear up how proud I was of these students. I overheard a social work student who's in my program, and she was speaking as if she had already had her degree, and she seemed like such a colleague. So she was really challenging this idea of what it is that social workers on a team can do, and the importance of not just looking at the biological aspects of a patient, but the psychological and social aspects as well. There's nothing I would have changed in the way she was talking about social work. And again, it might sound strange, but because I was in Zoom, she didn't know I was there, and I was just popping in to see if students had questions. But it was in that moment that I thought, students are taking off with this. We're able to provide a level of support and foundation, but they're really able to talk colleague to colleague and future colleague to future colleague about what it means to deliver healthcare, about what our particular professions can add to that healthcare team. And so for me, I'll just sort of remember that moment as, yeah, we're witnessing our students really going from student to colleague in real time and able to talk directly to each other, which was just a real special moment for me to oversee.
And I think I've been lucky to have a moment similar where it sounds funny to say, but I feel like it made me tear up a little bit too. Obviously, we'll have, we talk about outcomes and getting down to like data, where people, we hope to see where they matriculate to in terms of where they choose to work. I mean, that will be data we look at, and hopefully we expect to be very proud of that after the program's been around for a while, just based off of post-grad training, residencies, et cetera, and the amount of, we are actually collecting the amount of community members we've worked with, and looking at actually validated tools as well to see, pre 2 years and after 2 years, how much of their ability to work in interprofessional teams has grown and learn from Underserved. But a moment that sticks out, not nested in data, was a pharmacy student in the program, had reached out to have a meeting, just a check-in with me, not too sure what it was about, and she'd had some questions just generally about, looking, and I think she's about to go out onto her final year of rotations in the pharmacy program, and she said, off cusp, we were talking about something different. She said, "Oh, well, by the way, thank you so much for everything that you and everyone's done with the Trust program. It's the first thing I mention whenever someone asks about Binghamton or just talks about pharmacy in general." She said, I've learned more from those workshops than I have probably in the classroom. And that just, I think I just stopped for a second. I was like, okay, don't tear up over Zoom. But it was finally, I think we've, we're not alone in saying that a lot of the pandemic and everything we've been scrambling and developing a new program has been, had its ups and downs. But at that point, I was like, I think we're doing something right. And it was really nice to see that motivation and passion that we've been able to cultivate in not only her, but hopefully many more students who've gone through the program. Mm-hmm.
Well, it's awesome to hear how this has had a real impact, especially after how the last 2 years have been so difficult, and you feel like you're just doing whatever you can to keep the program going, and you hope that it's doing what you want, and then you get that firsthand feedback is just great, and hear that the program has really been very key to developing the students' skills and confidence. And it's doing what exactly it should be doing. It makes you encouraged to get out there and to do it some more. And so we have a little bit less than 10 minutes. This has been just so quick because it's been fun to talk about all of this. And so kind of break the wall to say, if you have questions, please be sure to send them in because we're running out of time. And so I wanted to make sure we have time for, I know you have quite a lot that you wanted to talk about and only so much time to go around. As we start to wind things down a little bit, what are some of the other areas that you'd like to share, or what you hoped would have come by way of questions, but we can kind of preempt some of that and answer it here?
Sure. I guess I'm sort of thinking about the future, Steve, and in 10 years, where do we hope that this program is? And I think we probably have a collective vision for the impact of trust on our students. I mean, we certainly hope that they'll look back at their time at Binghamton and point, as your student did, Bennett, they'll point to this as influential and as important. But I get excited when I think about the ways we can measure trust affecting the communities. And quite, I know it might seem pie in the sky, but I think this is a program that can play a role in changing healthcare delivery across the region in underserved communities and rural communities. I think we'll see evidence of trust scholars being out in the community and becoming leaders, because they already are. We're seeing witness of that in our program. So I'm very excited to think about inviting some of our graduates back in so they themselves can be on our panels. They themselves can share with the future students in trust the things that they've learned, the things they wish they knew when they were at Binghamton. So I get excited thinking about our student colleagues becoming healthcare colleagues and being leaders that we can partner with as they go out and change things in the community. So I'm excited to see that happen.
I think the only other thing that I'm trying to think, I've been very fortunate that we've been able to touch on a lot of things throughout these 30, 40 minutes. But one of the things that, I think that Trust has always made sure that we focus on is the ability that we want to make sure we are pushing our students and individualizing all of our material for what they want to learn, and really focusing on making it equitable between all disciplines and learning how to work in a shared environment. And that's including that patient, that community member on that team too. And I think it's so important to, again, focus more programs on that. So I hope as we look into the future, like Sarah had mentioned, that we continue to see this program grow and our students grow, our faculty grow. I mean, we are working on a few projects already that we're hoping to share some of the knowledge of this program. We've also partnered with the AHEC Scholars program, so the Area Health and Education Center Scholars, the National Certificate Program, so our students have that ability too. So I think giving them those tools and those recognitions, I hope will lead them to success, and seeing them come back, I mean, that is something that I'm very excited to see too. But I hope that this is just one way that we hope to maybe some of our students go out and start a program similar or whatever, or spread some of the knowledge that they've learned, or start those conversations. I mean, that's the big thing, is that we want to just see our students continue to grow and see where they end up successful.
With this being campaign launch day, it just got me thinking about the history of the university. And so it started out as a small liberal arts college, and its initial offering wasn't even located where we're sitting now, and then took some time and built the campus here, still within the model of a liberal arts college, and then adding on business and engineering and nursing. And this is a real shift now. And so with the campus in Johnson City and this health sciences campus, this is the next direction for Binghamton. And so I guess I'd ask each of you, as maybe sort of a final question, how does it feel to be a part of that new direction, something that's so exciting is going to take Binghamton and put it on the map for something else completely new and awesome?
It's really humbling, Steve. I know that we are one part of a wider focus on interprofessional education at Binghamton. We are one of many initiatives, and it's inspiring, I think, to be a part of that. I want Binghamton University to be known as a hub for producing future healthcare leaders. And I want people to think of Binghamton when they think about folks who are able to work on teams, lead teams, to talk across disciplines. And I think we're already on the map for that, but to continue to challenge our students to really say, why is it that team-based education is best for healthcare? Why is it that the diversity of professions and people around the table truly makes effective change? So that's what I want Binghamton to be known for. And it's humbling to be a part of those conversations as we get Binghamton on the map for interprofessional education.
And one thing I'll add, and which you alluded to, is our location here, I think, gives us a strength. I mean, one way that I've at least seen Binghamton make a name for itself is just its ability to work with rural communities. I mean, we are in a rural area. We are trying to give back as much as we can as a whole university, and we are just one facet of that. But I think that Binghamton has already and will continue to make a name for itself because it has rural right around it, and we're spreading as much as we can into helping those communities grow. I mean, just being in Johnson City with a pharmacy school there right now, I've seen a lot of changes over the few years I've been here already, and I know that it extends much farther than just Johnson City. So it's really nice to be part of something that you can see growth and really community engagement in everything we do.
And Binghamton is really helped by its location, not only by being near these rural populations that you're looking to serve, but it just feels like it's close enough to almost anything that you want to get to. Like it's not isolated at all. You go to New York City, it's 3 hours. Philadelphia, 3 hours. Go to Cleveland, it's 5 hours, or just all points east or west. It's very easy, and you draw in the best of the talent and the students. And I think that could be, has been a real draw to get these bright minds into the program from there, and then take advantage of the location, and easy enough to get from main campus Johnson City all around. So. If there's a mini advertisement for any students watching us, come to Binghamton because we're located in a prime area for sure. So, and Trust is a fabulous program. I know the university is very, very proud of it, and I see it gets a lot of coverage, and so we're really very thankful to be able to present that as part of campaign launch day, and I hope our alumni and friends watching have found this to be an interesting and fun 45 minutes or so to dive in and learn about the program. So Bennett and Sarah, thank you very much for being part of us and giving us part of your Saturday to talk about the work you're doing and talk about Trust and to share this with our alumni. So thank you.
Thank you.
Thank you, Steve.